No, 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 no. Oh, go, 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 carry. Where's my cable? Hello. Hello, hello, hello. Is anyone here with us? Is anyone here? S- Hey, 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 hey. Sorry. So sorry about all the delays and everything. Guys, let's just pop in. Oh, thank you, Insika. I see you. I see you, Insika. Yeah, please let's get them in. Let them pop in. Pop in. I mean, we are some minutes late, but it's okay. I mean, it's Saturday and we're home. So let's do this. Let's do this. Let's do this. Get them in. Yay! Woo! Oh, right. So let's do this. Where's everyone? Get them in and let's start our Uskies. Mercy, Joy, Abata here. Yes, I see you. Thank you. Please help me let Francis know that we are on and we are live because he has called earlier. Um, you're on and live. All right, let me send the yeah. Please do send the link. Thank you. Um, oh, it was such a battle. Thanks for you guys that have kept on holding on. Thank you so much. I needed to get through with this. I needed to get through with this. Thank you so much. On and live. Just search Bella. I'll be back. Right? Yeah, so taking off that one. So yes, yes, yes. I think I would like to start with should we start or should we just give some people like 5 minutes into the answers and questions, or do we start with the tips? Do I start with the tips? I normally would like to start with the tips on, mistakes and errors to avoid, and would do it according to the stations. Okay. Yeah. But first of all, the thing I'd like to share with us is I'll just give us more time. And please, as we come in, I know we have like 3 people here or 4 people are already connected. Please, if you're in here, I just need to know the people we have here. Just say hi, and that's all. Just say hello, hi. Then please, when you have questions, let your questions come up. I'll be able to respond to your questions. But before, I'll just like to start with tips. I always say that the enemy or the what you're fighting against is your in your OSCE exam. Yeah, Anom and Zaida, I see you. Good. Thanks for joining in. Anom, I see you. Right. So what we're fighting against is anxiety and calmness. I've spoken to more people, and I'm sure you guys were able to see the people. Hi, Siner, I see you. Thanks for joining in, Siner. I see you. I'm sure you guys are able to. You heard the stories from the people who we spoke with, and hey, Manju, I see you. Thanks for joining in. Okay, sorry we're a bit delayed, and that was due to technology and things. If you're not an expert in these things, sometimes it can be a problem. But I'm happy we're here. So, going on and talking about anxiety. If we are so anxious, we just get destabilized. So, you know that thing we always tell to our patient, or encourage my patient to take a deep breath and carry a deep breath exercise. You all need to learn how to take deep breaths. I tell you, it does work. It does work. So it's about taking deep breaths through your mouth and then expelling. You know, if you're with me right now, please just do it. Try it. Do it properly. We're not just doing no. Take in air through your mouth. Then it somehow relaxes you. It relaxes you. Now, if any point you get stuck and you don't know what to do, please calm. Just take a moment to calm. Just calm. Don't rush in. Another thing I've seen with people is they're trying to rush in and finish up. I understand the time. People have said the time runs very fast. But please don't rush in. Calm. Before you start, your examiner gives you the opportunity to ask questions. She gives you the opportunity to say, are you ready to start? Don't rush in and say, oh, yeah, yeah, I'm ready to start. Don't do that. Okay? Or just say, okay, so please, can you give me a minute or two? I just want to calm. It's okay. It's allowed because they know you are tensed. They know you are anxious. They understand how it is, especially if they have assessors who are who have been through this exam. Okay, some of them may be international nurses, so they understand. So please just tell them, give me a minute before you start. Please don't rush in. They would allow you. Okay, that's one. Another thing, before you start, when you get in, they would ask you, do you have any questions? Right? Look around your surroundings. Is there any instrument you see that is not familiar? Is there anything you see you don't understand? Is there anything that looks like not what we are used to? Okay, great. Sine has popped in the first question. I'm going to answer that. Let me finish the question with the statement I'm making about on entrance into your station. So anything you see that doesn't look like what is familiar to you, please ask questions. So for the nasopharyngeal, go to the I know we've sent a video, a clip of what the suction machine looks like. Please go and have a look. That machine has confused some people. Go and have a look at the video, go and have a look at the clip or the picture. If you go and download the equipment used for OSCE exams, you will see what that machine looks like. Take the name, browse it, go and watch the video so you see where you need to put the tube in and how you need to connect the catheter tube. Some candidates already struggled with that. So please, I'm using this as an example because some of you have not seen the exact sanctioning machine that they use at the test centers. So please go and look at that. I'll talk about timing, I'll talk about documentation, I'll talk about how you can verbalize your timing. Hopefully that would help. But let's start with taking Sine's question. Sine says, hi Bella, amlodipine frequency is not on prescription and scenario time is 100 hours and time of amlodipine is 100. Am I supposed to administer amlodipine at 100 or 20? Okay, yes. Sine, if you've worked with me closely or you've listened a lot, you hear where I say that sometimes we prepare these charts and in the process of doing the copy and paste, we may sometimes not correct that. So I'm sure that nocte was supposed to be like a TDS and not a nocte, because if it's a nocte, it means you will see 2200 or you may see 2000. Okay, so but in exam, if you ever see something like this telling you 1100 and it's saying nocte, please code it and sign in as not clear. Okay, so this scenario you're talking about, if you see amlodipine stated for 1100 hours, 1100 hours is in the morning. Remember that they use the military timing, 24 hours timing. That's what they use. So if you see 1100 and you see nocte, please, it's not clear. because you can't say nocte and you see 9 a.m. So it's like seeing nocte and seeing 9 a.m. And as nurses, as registered nurses, we know nocte is for the night. Okay. So Sine, please, if you see something like that, don't just put the code in as not clear. Now don't put other. There is a code for not clear. Please let's check our chat now. Let me know whoever what's the code for not clear. For those, if you've got your chat with you, what's the code for not clear? Please. If you know it, please put the code in the chat box so we can all be on the same page, please. Okay? If you have your implementation chart with you, and now not just any implementation chart, we're talking about the if you have your yes, okay, that's 6. Thank you. Yes, so oh, Sine says thank you. I understand. All right, that's good. So you put not clear. If you put that, that's it. Francis, I see you. I see you. Thanks for joining in. Sorry about the delay and the wait. Okay. So please, if we have another question, so I've answered Sine's question. If you have any question, yes, 6, good. So please, if you see any prescription, and this means we need to be alert. If you see any prescription that doesn't seem clear, they will mark you right for saying it's not clear. I will clarify with the prescriber and I'll get back to you. And then you don't give this drug, you code it. Please, let me share with you the sequence. Hi, Wendy. Morning. I'll talk to you guys later. Some tricks on the implementation section. We'll talk about all of this. Now, again, looking at this scenario that was just posted about the amlodipine, just don't mention it's not clear. Remember, any medication that's due your time, it's due your time, and you are not going to give either for one reason or the other. If it's the fact that it is not clear, if it's the fact that it's been given at start dose, if it's the fact that the patient is allergic, please remember to code it, sign, go to the last page and chart it at the medications not administered. You must follow that sequence. Then you know you've done the right thing. It's not enough to say, oh, I'm not going to administer this medication because it's not clear. However, I will get to the prescriber. Follow it up by coding it and putting it at the back. Then you have done the right thing. Okay? Great. So I hope we understand. If we understand, please just let me know if you understand this sequence I've just explained. The sequence of communicating that it is not clear and that you will not be given, the sequence of also coding it and then chatting at the back. I've just given us 4 stages. You understand? Thanks, Francis. Thank you for the thumbs up. Right. Okay. So yes, thank you. Very clear. Marcelo, I see you. All right. So good. Understood. Thank you. Olalademi Ashake. All right. Yes, thanks, Anam. Have we got the next question or should I continue with the tips? Have we got the next question? Or should I continue with the tips? Yes, I understand. Yeah, thank you, Nsika. Hey, hello, Anne. Hi, Anne, I see you. Right. So let's go on with the tips. Wendy says, is that okay with everybody? I like us to all be on the same page, okay? Please, then let's go into our PQRST. It's a verbalization station. Okay. Oh, okay. Senior has brought another one. I think there's something with implementation. So it says, sorry, Wendy, let's hold on. Let's take the question, okay? So that we can, clear our chest off and, have build up our confidence again. So if lansoprazole is prescribed, all right, great. Thanks, Isika. If lansoprazole is prescribed in as required medication, that's a PRN, but the indications mention pain and pyrexia. What are we supposed to put on clear code or leave it because it was as required? Yeah, this prescription is not clear. Sine, I'm so sorry that those charts are messing, it's just messing up certain things. So Now we know, as registered nurses, we know what prescribed we know what indications are for what the indications for lansoprazole are is. We know what it is. Okay. So because we know what the indication is, if you see lansoprazole and you're seeing pain, that prescription is not clear. It's as simple as that. Okay. So it's not clear. I know you guys, maybe you guys have been practicing with it like that, but sorry about that, but it's not supposed to be there. Again, it's all this copy and paste. Please, those charts that we've used to practice, I see some things that have gotten some people confused. Someone shared with me last week and says, "Oh, we see NMC on it." Please, it doesn't mean it's straight from them, please. We create it when we teach in class. We're trying to create a scenario, we're trying to create a condition like you are in exam setting. Okay. I think we might need to edit some things just to help other people coming up. So please, if you see lansoprazole and you're seeing that the indication is pain and pyrexia, me and you, we know that that's not correct. Okay. Right. So, Sina, is that okay? Is that clear? I need you to respond, and so I would move on. Yeah. So Francis says, do we necessarily have to put a related to an evidence by if the problem is a risk? Now, to answer your question, Francis, to answer your question, I just Senior, thank you. It's clear. Good, fantastic. Thank you. Good. I'm happy I'm able to answer that question. Let's take Francis' question. Truth is, like I said, when I first came to the UK and when I heard about their planning scenarios and things, I was really happy because I felt, okay, yes, we are not using Nanda and all of that. Okay. However, um, at that time, people used to just we could just put pain. Some people just write pain due to. Okay, remember that due to is a similar word as related to. Okay, so some people just write Daniela is experiencing pain. At that time, it was quite acceptable. They used to accept all of this. Now, because of the way things are, because of the pass rate, because certain test centers are beginning to scrutinize and look into details, we want to make sure we are on point. And because there is this whole thing about evidence based practice, we want to be on point with our planning. Previously, in our time, as at 2019, 2020, people never failed planning. The thing people failed were maybe implementation or their skills mainly. People never failed planning. So as at 2021, when people started failing planning, we're getting surprised as facilitators. But it is now the case. So I think if I were you, because you don't want to do trial and error with yourself, if you know how to write it, please just write it. Now, but for risk, sometimes we write, let's give an example. Daisy is at risk of fall related to confusion. I'm just using Daisy, I'm just using any name, okay? If you say related to confusion, if I want to say I'm a professional nurse and because I work according to evidence-based practice, how do I know my patient is confused? Was there anything I did to show my patient is confused? If I have, yes, I put it there. Why? Because we both know it. We know that either we carried out a GCS assessment, neurological assessment, right? So put it there. So related risk of fall related to confusion, evidence by a GCS score of 14. Okay. Or related to a 6 CIT score of this, we know the patient was confused. But there are certain risks that is quite visible, okay? Or maybe it has not happened. Like, let's look at risk of bleeding. Let's look at risk of infection. It has not happened, but because the patient has is going to have a surgical, has had a surgical intervention. Remember, we use risk of bleeding and risk of infection for post-op planning. So if we use, who should I use? Let me use any name. I don't want to use names in your exams, okay? I'm going to use any name. Let's use Jones. Jones is at risk of bleeding related to surgical intervention, okay? So, surgical intervention. So, it's going to be at risk. Do we have evidence? The evidence is still the surgical intervention. Do you get it? It has not happened. Same thing with the confusion, though. It has not happened. But because we have an evidence, we just want to put it there. You look very scientific. You look very, very professional. If you now get an assessor who would want to look into details. So it's about giving your best. Let me say that. So if you say related to evidence by, if the problem is a risk, if you have the evidence, good. But if there's no evidence, the evidence of a patient going to bleed is just because the patient has gone for surgery. That's all. It has not happened. It won't happen. But the evidence of the risk, okay? Now, the evidence we're saying is for that risk. So how do we know that there is a risk? If I should say it that way, how do you know there is a risk to bleeding? It's just because this patient has gone for surgery. So we need to keep checking her to be sure she doesn't bleed. How do we know this patient is at risk of infection? Because she's been cut open. Of course, once there's an opening, there is a risk. It is now our job as nurses to protect and make sure it doesn't happen. So it's still just the surgical intervention. Okay. So I'm sure for something like risk of bleeding, if you write Jones, it has risk of bleeding related to surgical intervention, okay, or due to surgical intervention, I'm sure they won't mark you down. I'm sure they won't mark you down. Okay. So it's the same thing with like confusion. If you write, yeah, okay, I see Francis. So if you write Jones, it has risk of fall related to confusion, I'm sure they will not mark you down, but just give it a push by just saying, if you say evidence by, the total GCS score of 14, that's also great. Remember, the goal is we want to give our best. So it's not like, oh, I wish I had done this. This would not have happened. Okay, Francis, I hope I've been able to, just make that clear a bit. Okay, we're just giving our best, right? Okay, thanks. He's done with that. So who's the next one? I'll just go to Nikita. I've seen your question. I'll take it, but please let me respond to Manju. Manju says, in Alzheimer's scenario, coming to disability section, do we ask questions for confusion? What do you mean? Do you ask questions for confusion? You know that in Alzheimer's, Manju, I hope you're here because I'm now responding to your question. I hope you're here. Just let me know if you're here, Manju. Just put a hi. Just chat a hi. I know you're here, so I know I'm responding to your question. Okay. Um. But I'm going to respond to the question now. It says, in Alzheimer's scenario, coming to disability section, do we ask questions for confusion? You know that in Alzheimer's scenario, we are only using the News 2 chart. Great, Manju, thank you. We're only using News 2 chart and the 6 CIT. Okay? The News 2 chart, when you get to your disability, there is alert, we've got alert, and then we've got confusion, and then we've got the other point, the ACVPU. So now, this point, that's where you want to ask your patient, do you know where you are? Okay, do you know where you are at the moment? Alzheimer's should be a home scenario. It should be a community scenario. Okay, please, these are the things we need to look out for. Is it community scenario, hospital scenario? So the patient says, oh yeah, I'm in my lounge, or no, I'm in my hotel. Or if the person goes off point, it's sign that this patient is confused. You want to ask, do you know what time of the day it is? At this time, this is about 11 o'clock, and this patient is saying, oh yeah, is it 8 p.m. in the night? I'm about having my tea, or whatever they say. The patient is off point, the patient is confused. If we then say the 6CIT form comes pre-filled, please and please save your time. It's pre-filled. You don't need to ask any question, except your form comes empty and you're not asking a question. Sorry, if your form comes empty, you need to then ask the question. Okay. But from trends, from other scenarios of people who had the experience, they didn't ask the question. Why? Because they've put the score in there. Your job is just add up total. Then the meaning of your scoring is there. Do you need to refer? Do you need to is the patient experiencing significant cognitive impairment? Okay. So please, when you get that form, don't start assessing for confusion. Okay. Your 6CIT, as long as it's filled up already, all you need to work with is add your total, escalate, say what it is, and then move on. Okay. However, what you want to do is in your news to chart, your disability, then ask all this type of questions to check for orientation. Do you know where you are? Do you know who I am? The time of the day or the month of the year. That is where you ask for confusion, please. Remember, we are racing against time. Please, if your 6CIT form has been filled, no point asking one. Please save your time, save your time. Remember, the most important thing is your chatting. Go back. If you've got more time, go back, check your chart. You've done it properly. Check with your candidate note where you've written your numbers. Check your chart. Everything is on point. Make sure your total is right, and that's it. Okay. Manju, are you clear with my explanation? Was I able to answer your question? Just respond and let me know, either with a thumbs up or just say a yes, and I'll get through with it so I can take on Nikita's question. All right, thank you so much. Yes, thanks, Manju. Thanks for responding. Okay, so Nikita, Bella, for the medicine, like midazolam, can we give it like other medicines, or do we need to call second competent person to give it? Yeah, the thing is, we need to find out. I'm not sure we need a second competent. Midazolam. Is midazolam a CDA controlled drug? We need to check that first. I can't remember now. So please, Nikita or anyone who is there, can we just check midazolam? Is it I can't remember. But if it's in your regular medication, I think you should give. But before we conclude that, we have to be sure, is it a controlled drug, first of all? So please, can someone check if midazolam is a controlled drug, and then we can check that, okay? If midazolam is a controlled drug. So before I want to just go to points I want to share with you guys to avoid some things to avoid, so you don't make a mistake and have error in your exam. If that's okay. Yeah. Nikita, it's just Nikita I'm trying to respond to. Nikita, if you're still there, please let me know. Okay. And then if Nikita is not there, we'll continue with yes, you're here. Okay, great. So please let's find out midazolam. Is it a CD? Because that's what would determine if we need to say, assessor, please, I'll need a second checker for this medication. You know that if it's a CD drug. If it's a controlled drug, we need to say, assessor, I'll need a second checker for this medication. Once she gives you a go ahead, please go ahead. Okay, please. Let's not draw back and hesitate. Always listen to the promptings of your assessor. That's one of the things I want to share with us. Before we continue with that, Nikita, please let me know what's going on, and then I could pick up that question again. But before then, another thing I want to share with us is, please listen to the promptings of your assessor. In between, your assessor speaks. Oh, control drug. If it's a control drug, please mention assessor. I would need a second checker for this medication. Okay. I'll just put it in the chat box. I'm just typing in inform you. I'm typing in so that anyone can see this later when if they come in at any time. For control drug, please inform your assessor you need a second check. Okay. 3 CD. 3 CD. Who's rookie? Okay, 3 seconds. It's not in a register. Rookie, what do you mean when you say it's not in a register? Please, can you just. Who is Rookie? Is this Mercy? Oh, sorry, Alberta. Sorry. I'm sorry. Um, can you let me know what it means when you say it's not in the register? So I want to have a picture into what you're trying to say, and then let's know what it means. Please, at this point, if you see a medication you are not clear, it's better you say, I'm not clear with this medication. It is CD, Bella. Yes. So somebody saying it's CD. Okay. So Alberta, if you want to let me know if you want to let me know what you mean, okay, need a second checker. Okay. So for a controlled drug, please, we need to say that. Hopefully, they don't stress you out with giving you a controlled drug, but you need to know which is a controlled drug and which is not a controlled drug. All right. Great. All right. Great. So please, if you ever see something like that, that's what you do. Assessor, I've been this the patient has been prescribed this medication is a and is a regular. Now, let me share with you if it is a regular medication or a PRN, what can we do? Now, if it's a regular medication, it means this patient has to take it. It means you need to give the patient. That's where you say, assessor, I'll need a second checker for this medication. Now, if it is in PRN, which is as required medication, you want to know, does this patient require this medication? Another thing you want to know is there another medication you can give in place of that medication? Another medication also in your PRN, okay? Also in your as required medication. That will then determine if you should give that or give a lesser one that doesn't need a second checker. There is a scenario that we have that has morphine and paracetamol. Okay. And we've always encouraged that you give paracetamol from the as required instead of the morphine. Because for morphine, you actually need a second checker. Okay. So you want to give paracetamol that doesn't need a second checker. Okay. So I would move on now. If there's anything you need me to know, please put in the chat box. Another thing I need you people to look out for is promptings from your assessor. A prompting from your assessor could mean different things. Okay. It could mean you're doing something right. It could mean you're doing something wrong. It could mean you've forgotten something. Now, because you need a prompting, don't always stare at your assessor. You know those assessor, because it looks like you want an answer from your assessor. I was reading through the site. I was reading through, I think, one of the test centers or some things, a document, and it says, it was in bold, and it says, please speak to your mannequin or the patient, which is your actor. Do not speak to the assessor. I'm sure so many people have not seen this. Speak to your mannequin or the assessor. However, there are certain times where you just, have a glimpse at your assessor. Okay? Sometimes it depends on whatever they say. So once you hear things like all checks done, please just move in. Remember, when you hear all checks done, they're not trying to confuse you. All they're trying to do is to help you speed up your time. So for some people, some people hear all checks done and they begin to be confused. Please don't get confused at any point. Don't get, once you hear all checks done, we know what to do. Go straight. Go straight. Perform your hand hygiene. Some will tell you all checks done. Just go get your equipment. It will help you save your time. This is not the time to act confused, please. If you ever think you're getting confused or you're getting stuck, give yourself some second, pause, then continue. I said some seconds, please, not a whole minute, because your time will not be paused. Remember time, okay? I've talked about promptings from your assessor. Another thing I like to talk about is time. Time. Time is a factor. Some of you have met other people who have had their exams, and the challenge is time. Time. Please, as you walk, your eyes should be on the time. As you walk, check time. Take time to check time. I like that phrase. So I'm just going to put in the chat box. Take, I'm going to put in the box. Take time to check time. It's very important. Please, some people, because they're so focused on what they're doing, they forget to check time. Please, you can't forget to check time. Once you start, you hear your time starts now. You look at the time, then you start. As you go in between, look at your time, move. Look at your time, move. Always check time. Now, when you start your scenario, your assessor always explains to you. The assessor always says, your timer is there. Please know where the timer is. We know, we have an idea what the timer looks like. We do have an idea what the timer looks like. If you don't have an idea what it looks like, let me know. I'll show you. But they will show you once you get to your test centers, okay? Once they tell you that, please know that you have to be checking time, and you're working and you're checking time. That just helps you keep to time, okay? A strategy you can use for planning in time: divide your time into two. Reduce your time first, divide it into two. In the first 5 minutes, this is what I want to achieve. Okay? In the first 5 minutes, I want to achieve the first page. In the second 5 minutes, the second page. Fill it up. What have you done in the 10 minutes you've got? And then you've got about 3 minutes left. Fill in the spaces, cross your T's, dot your I's. Remember, for planning station, you want to make sure you write your name, sign, date first. Any form, any paper you are giving, those are the things you want to do first. Okay? So I've just said something with time. This time is regards to all other scenarios. Every scenario you get, please and please. Time. People complain about time. And exam condition comes in, anxiety comes in. You need to be able to manage your time. It's not nice, it's not fair when people just fail all because someone didn't finish. Implementation, you need to find your best strategy. Look, there's a strategy that's best for you that you can use, and only you know that strategy. Use it. Okay? I'm going to take Anne's question. Okay? Is that Anne? Anne said, if giving a mannequin in assessment, do I still need to use the blood pressure cuff for BP? Beautiful. Good. So Some people may use mannequin, some will use a real life actor. Okay. For the real life actor, we know what to do. I come into my patient room, I check for scene safety, do all your procedure, check your pulse, 2 full minutes, respiration in that 2 full minutes. Okay. Fine, you do everything. But for the mannequin, previously what they did was they give you uh something called like a flashcard. Okay. So they give you like a paper, they put the observations in it, but they will turn it the other way around. Okay. So when they give you a flashcard, it's written there, they turn it down. But when it gets to the time of your observation, when you start with pulse, all you need to do is when okay, let's go to start from A to E. Assuming we have a mannequin, let's go to A to E. Okay. Remember that while you've been asking all your question, your assessor is the one responding. Please face your mannequin. Okay. Face your mannequin, your assessor is responding. Okay, and you know you've confirmed a name, date of birth, allergies, and all of that. So the next thing you want to do is your assess. Okay, so I'll be starting your A to E assessment. I see you've been speaking to me. Don't say it's a mannequin. She has not been speaking to me. Please, for those people that want to, detail, please. The mannequin has been speaking. Who has been speaking? Your assessor has been responding. Okay, I like to make that clear. So I see you've been speaking to me, and your airway is clear, there's no obstruction. Okay. Then for breathing, if you don't mind, I would like to check your pulse at this moment. Please, can you put your hand across now? You're talking your way. Remember, mannequin, you can't get any pulse, you can't get any blood pressure. What you are doing is verbalizing your way. So I would like you to put your arms across. Please don't carry the mannequin's hand. Okay, just do what you can. So you don't, offset everything, and then mannequin is falling off the chair and things are, and then you're destabilized. Just carefully do what you can. Okay. So I'd like you to put your hands across your chest for me. If this arm is okay for me, is that all right? Okay. So I'll be checking your pulse for 2 full minutes. At this time, I'd like you to be quiet. I'll also be quiet. I'll first of all locate the pulse. I'll locate the the pulse, the radial pulse. I'll locate it, and when I locate my pulse, I'll be checking the pulse for 2 full minutes. You're not at that point. You won't check for 2 full minutes. They won't allow you check for 2 minutes because you are not checking anything. Okay. So what you do is I'll be checking the pulse for 2 full minutes. Again, listen to the promptings of your assessor. Your assessor could say something like, "That's 2 minutes is done." So when you hear 2 minutes is done, you want to stop immediately, please. Okay. Once you hear 2 minutes is done, stop immediately and go on. Remember, the figure already has been done. Okay. The figure has been done for you. So don't stay your 2 full minutes. They just tell you it's done, move on. Then from there, you go on to the next thing. So you say, okay, I've done your pulse. I'm sorry, I checked your pulse for 2 full minutes. I didn't let you know because it was going to alter my reading. I also checked your respiration, but you're not giving any figure because you've not been giving any figure. Okay. And I'll note that down. You just say it. And I'll be noting the pulse down. And I'm sorry, I checked your respiration. I also note that down. All right. And then we'll be going on to you go on to the next thing, but you're talking your way through. I'll be checking for your oxygen saturation. If you don't mind, I'll be looking at your hands. Can you lift your hands for me? I see that there is no there's no nail polish, no artificial nail. You're warm to touch. I would like to depress your nail to check for the capillary refill time. Yes, capillary refill. There is a new thing. Is it new? I'll share it with everyone now. And then you tell the patient what you want to do. I'd like to depress your nail to check for the capillary refill time. I found out that they wrote 5 seconds. We're always saying 2 to 3 seconds. However, some people said 2 to 3 seconds and they passed, but somebody was, I don't know, somehow, for because they said she didn't say it was up to 5 seconds. Now, the strategy we are going to use is I'll be depressing your nail for 2 to 5 seconds. I'm going to put that in the chat box. So for capillary refill, we mention depressing the nail for 2 to 5 seconds. Okay. Now, because I had to go and check, I had to go and check the nail bed. I think it's nail bed. I don't want to leave it at nail. I had to go and check Royal Maston, which is what we use, which is what we use to read. Okay. And I saw 5 seconds. I'm like, ooh, this has never been, assessed like that. So please, it's coming now. You have to get used to it. Please say it. I'll be depressing. Yes, I'll be depressing your nail for 2 to 5 seconds. I'll be checking. So the capillary refill returns within 2 seconds. I see you're well perfused. You're not pallor. You're warm to touch. We've covered those things that's been asked of us in the marking criteria. Do we understand what I've just explained? I need to. I'm happy I was able to say this with regards to this assessment. Please, when we're checking capillary refill, we need to mention, I'll be checking the nail bed for 2 to 5 seconds. Mention the five loud and clear so they hear you. Okay? Oh, please, you need to say all the qualities of those. Okay, Maju, thanks. So you understand that. Thank you. Thanks. So please, if you understand what I said about the capillary refill time, please let me know. Either just give a thumbs up or just say, yes, I do understand. Oh, I understand. Just let me know. I need to make sure we understand this. I think I shared it. Thanks, Nikita. I think I shared it to some of us, but I think most of cohort 6, some of you were not around. So yeah, good. All clear. Thank you. Thank you. Thank you so much for the thumbs up. Good. If Anne, am I able to answer your question? You will still do the same thing, but your pulse, you can't stay there for 2 full minutes. So even your blood pressure, you're talking your way through, you're saying the same thing. Okay. You're still going to say, I would like to check your blood pressure. What arm would you prefer? Have you had any surgery on this arm? I'll be applying the cuff on the arm 2 to 3 centimeters above the how many centimeters above the antecubital fossa? Mention all of that. But before I do that, I'll assess for any sign of inflammation, any sign of infection. You are doing the same thing, but you may not get a reading. You're talking your way through. So somebody asks, we don't have to say pulse is strong and feeble as well as respiratory. Please say it. Please say it. Okay. We want to make sure that we don't want to leave any loop end. We don't want to leave any ends loose, because we don't want a place where they'll say, oh, because candidates did not mention that the pulse, quality of the pulse. Please, so we need to still mention, just as you say, the airway, there's no obstruction, is clear, is this. The same way we would mention the pulse is strong, is regular, is bounding. Okay. The same way you mention about the other things, you still ask about the urinary when you come to your disability. One last, have you passed urine in the last 8 hours, or what was the last time you passed urine? Please save your time. All those people asking about the quantity of the urine, the quality of the urine, please save your time. What we need to know is, when was the last time you passed urine? Okay. The patient has passed urine. That's what is most important. Remember time. So all those unnecessary talks, please cut them. When was the last time you passed urine? Good. Are you diabetic? When have you had your blood check? When was the last time you had your blood check? Please go straight to the point. Okay, I see you are diabetic. Leave all those talks. Leave them. Okay. Let's go straight to the point and meet our target of finishing up documenting properly. All right. What else? Is there any question before we go on to something else? Any question? Have you got any question? I'm trying to bring up some tips I share with people. Have you got any questions or anything that is not clear? So I will just share with us before any question, please, for your ANTT, as much as possible, try to be very careful. Try to be very careful. So please, if I were you, between now and your exam date, begin to fall in love with all the stations, if you know what I mean. Fall in love with all the all the stations. Why? So you don't get there, you see it, and you are scared. Hey, no, please. We don't want you to be scared. We don't want you to get there and you become anxious. So, loving all the station, when you get there, what comes to your head? I'm able to do this. I'm going to do this. So if you come in with that in your head, you've boosted your ego, you've boosted your confidence. I'm going to do this. That will help you. But not when you get there, you see wound assessment. You're scared because it's ANT. I didn't believe I would get it. Please. So from past experience, we've seen people who ran away from certain stations. They got that station. Yeah, they got the station somehow. So please don't run away from any station. Work closely with those stations. So Anne says, are we allowed to mention the vital observation figures written on the flashcard while doing the observations of the mannequin? Most likely, I'm not sure you can do both at the same time. What they want to see you do is they want to see you do everything, and then when you're done, the period where, as you're doing, you're supposed to be chatting. Now, you are not going to be chatting. What's going to happen is you continue all the way through. And when you're done, okay, so please, if you don't mind, give me some time to chat my figures. Assessor, please, can I have my figures, the observations? So the time when you leave the patient, you ask for the observation. Your assessor will then ask you to flip over your flashcard. If there is a flashcard, or they would have it somewhere written down, they will flip it over for you and they would let you know. Okay? So please don't, because if you want to do that, it will alter your time, it will break your time, it will slow you down. Okay? It will slow you down. So please practice. So if I were you now, between now and your exam, practice like you have a mannequin, practice like you have, in fact, you've been practicing like you have a real patient for as long as we know. Okay, so now start practicing like you have a mannequin. Get all the you're practicing, you're talking, you're doing it, you're talking, you're giving all your figures, you're checking the pulse, respiration, you're checking everything. You're not noting anything because you, of course, you can't get any number from your mannequin. When you're done, okay, so if you don't mind, I'll be transferring all your observation into my chat now. Assessor, please, can I have the observation for the patient? At that point, they will tell you, either they give you all the numbers or they will tell you to flip the flashcard. Just copy it, just start transferring. Okay, remember to help yourself. And thank you. So you understand that. Good. I'm happy you understand. Yeah, so I'm achieving the goal for this class. Good. So another thing to help you in your observation, so you don't forget, in your assessment chart, in your candidate note, we write all our numbers. And then we transfer to our news to chat or whatever chat we are using. As you are transferring, strike off with one line to be sure that you have transferred. So the moment you put in respiration on your chart, strike it off on the candidate note. Moment you put in the SpO2, strike it off on the candidate note on your chart. The moment you've put in blood pressure, you put on your chart, strike it off. Why? So you are sure you have entered all of your figures. Okay? You're sure you've entered all of your figures. So please, we don't want a situation where the candidate wrote it on her chart but didn't enter it. The candidate wrote it on her note but didn't enter it into the chat, please. Okay, we want to try as much as possible to avoid all those tiny errors. Okay, and I'm happy I was able to answer your question. So Sana, hi Bella. In homelessness scenario, it's in hostel. Like we start assessment for community like home. We say, is it the right address? What we will say to start assessment in homelessness? Wow, that's a question we've never looked at in practice. Real good question, Sana. You've given me the question to think on my feet right now. So what do we say? Now, to make it clear, let's be sure what our scenario says. Remember, there is always a scenario. Be sure what your scenario is saying. Is your scenario saying um you are in the homelessness, you're in a hostel, you've gone to see this person? Okay. So if that's what is the scenario says, your best bet is to confirm the name and date of birth. But hostel, yeah, I think if we confirm hostel, oh, what do we want to confirm? Now, I think look at your scenario. Sometimes there is no address. Homelessness. Homelessness scenario, I think there is no address. So just be careful, but we can confirm the name and date of birth. I think that's what the scenario may look like. Okay? I think the I think from the mock in the test from the test centers, there was no address, if I remember very well. But depending on what you see, so if there is an address on your scenario, ask for address, confirm, is this here? But if you look properly and you see that there is no scenario, please, the thing you want to confirm is, am I with am I with Jones David? Please, can I confirm your date of birth? um or another thing is, or you want to say, I confirm I'm in the right host on the hostel. It should be a particular name of hostel. Maybe they'll give you a name of hostel or something, but please, I think we should look at our scenario, that page. If you see that they write no address, please don't confirm is this, because there is no address. Okay, that's one thing I think may be common with community scenario. They might put no address, and that's what you want to work with. If not, confirm the name, confirm the date of birth. Most likely for community scenarios, the things we're confirming are name, date of birth. Even when you ask for ID, they'll tell you there is none. Please, if you hear I don't have an ID, please move on. Don't get worried. Don't start looking at your assessor. Oh, assessor, the ID. No, please don't get worried. Move on. Okay. And is that, and no, Sana, that was Sana asking that question. Okay. Or we say, is this the hostel of Frank Agaba? Yeah, yeah. So depending on what your situation is, yeah, sometimes I shared with people on Friday. Oh yeah, so we had some of cohort 6 in on Friday, and I shared with you that sometimes your answer has to come on the spot. Sometimes you see a problem on the spot, you now need to deal with it. Okay, because it will be determined by the scenario, and that scenario I don't have it, but you will have it. So when you have it, you could ask, am I in the right hostel? Am I in the hostel of, yeah, nice one, Ruth, thank you. So we could use that. Okay. Oh, Sana, it's clear. All right, thanks, Sana, thanks for making me know that it's clear. Okay, right. So do we have any other question you want us to tackle? Is there any question about any skill or about a scenario? Yeah, about BLS. I hope no one is scared of in-house resuscitation. Please don't be, love the scenarios. And I hope no one is scared of ANTT. Okay. Please, we need to love up on them so that when we see them, we are not surprised. Okay, we love up on them so that when we see them, we're like, I will conquer you, like I'm going to do this exam. Okay, do we have more questions, or should I continue with Should I continue with the things we can do to avoid mistakes? Good. So Francis has asked one question. Do we need a preamble for community setting? Like, oh, knock knock, is this the house of, yeah. Now again, let's look at our scenario. If he says the you need to go to the house of this to assess the patient and da 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 da. Now we know this is the patient's house. Okay. So now let me put it back. You know that you can't just come into my house. I come into the patient's room and you start closing the window and locking the door. You can't come into my house like that. Do you understand? So that's why we need to do that preamble if it's the patient's house. Knock, knock, hello. Okay. So if you don't want it, make it look too dramatic. Hello, hello, please, is this 14 Scarborough Street? Yes, please, is this the house of David Jones? They've confirmed that. Am I okay to come in? My name is Bella. I'm your nurse. I'm your community nurse sent to carry out an assessment on you. Is that okay? Good. I come into my patient's scene or patient's room or whatever you have to say. So now you want to go ahead. I provide privacy, perform my hand hygiene, because now you've introduced yourself, you are in the right place, they know who you are. I can now provide privacy, close the windows, draw the curtain, perform hand hygiene. Hello, my name is Bella. If you don't mind, can I confirm, please confirm your name again? Can I confirm your name with my document? The name is David Jones. Please look at your paper. Look at it. Okay, David Jones. And your date of birth, please. Please, when you're doing all of these confirmations, you need to hold your document. I know we know all of this, but I just like to stress it again. Okay. So, Francis, am I able to answer that question? Especially when it is the patient's home. But if it is the care home, if you get a scenario that looks like a care home, it's going to be like a hospital setting because the care home most likely is the patient's room, is the patient's environment. Okay. So you do that. Did I answer your question, Francis? On preambles, just let me know, for just give a thumbs up or something, just let me know I've answered your questions. Then Isikak says the scenario will have everything we need, let's just be spontaneous. Thank you. I didn't see, I thought that was, thanks for the comments, Isikak. Okay, we'll round up very soon because I think I've answered most of the questions, except we'll have more questions. Great, thanks, Francis. Before all of you run out, please make sure you subscribe and you like the video, please. Before you all start to run out, like my video, subscribe, please. Okay. For implementation in the community, do we ask the patient to bring their own water in order to take medication? No, Ruth, please. It is assumed that everything is there for you. Yes, we understand it's the patient's home and all of that. You don't need to say, oh, please, can you go and get your water? No, no, no. Just make it simple as possible. Yes, please increase the likes. I'm seeing it coming up. We have 12 people here now. Please, thank you. Just act like it is there. Your assessor will tell you everything. They'll tell you these are the medication, these are these, everything, and then start. Okay, but you know it's your patient's house. Everything is there, so you don't really need to. Another, please, let's consider trying to cut away unnecessary talks because now maybe the actor may not be expecting that and they may be look confused. They're trying to look at the assessor to know what to respond to you. That eats into your time. Remember, that does not, they don't stop your time. Okay, so please, you don't need to ask them to bring their water. You don't imagine if you ask the patient to bring the water, she would need to stand up, get up. That's eating into your time. You need to be very strategic. You need to have a plan. Okay. Have I been able to answer your question, Ruth? Ruth, yeah, good, good. I'm able to answer that question. Right. Do we have any question? I've just opened up the page that I want to share with us before we wrap up. Hopefully, we'll finish this session by 12 o'clock. We'll wrap up at 12. That was the focus. So, um, except anyone has any question, we'll wrap up on things to avoid, not to make a please, documentation, implementation. You need to make sure you read. You need to make sure you understand what they want you to do. Something they do for implementation, they ask for not only implementation, all other skills. Do you know what is expected of you? Please, if at that point you don't know, please ask them to explain to you again. They will do. But if you act like, oh yeah, 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 I know, I know, please, they would leave you. And then in between, if you make a mistake, they'll just watch you. That's not the best time to start talking to the assessor and saying, oh, assessor, please, I will need you to. No. Okay, please. So I've shared some things why some people have failed. Someone failed nasogastric tube, nasogastric, yeah, suctioning, nasopharyngeal suctioning, just because they didn't know they were going to connect the big tube first to the machine, then connect the catheter tubing to the big tube. Do you understand? So we have two tubes in nasopharyngeal suctioning. One tube goes to the machine, then the second tubing, which is the one that goes to the patient, you connect that one to the bigger tube. Please don't forget, don't connect. So somebody made a mistake. Of course, all of that's why we talk about anxiety. The person connected the direct tube that goes to the nostril, connected to the machine directly and started. You'd want to imagine, how did that happen? It's anxiety. There is no other way to explain it. So please, please, that's why I said we should go and watch the video. So Sine said, in the implementation, does the actors actually no? So Sine, let me give you an example. I thought I had a cup. The same thing we do in practice. They will just collect the cup from you, taking, they collect the tablet, taking. That's all. They're not swallowing it. What you then do is, please, can you confirm you swallowed it? You don't need to ask the patient, open your mouth. You can just say, please, can you confirm you've swallowed the medication? They'll tell you, yes, I've swallowed it. Some assessors, now before I jump into that, in implementation again, you might have um, mannequin or um, live patient again. If you have live patient, that's what we are used to, of course. We are used to all of that. But if you have mannequin, act like you're talking to a live patient. Keep talking to your mannequin, face them. Your assessor is responding, your assessor is watching you. Okay? So of course, if you have mannequin, the mannequin cannot take. You just say, okay, you take the medication. I've taken it. I'll take you. And here is your water. Just act like they're responding to you. For me, if I had a mannequin for an exam, I tell you, it just makes the job easy because it's like you're just going. But you need to listen to promptings from your assessor because she's the one responding to you. Then we don't need a water as well. Don't worry, you just have a cup. You have a cup. You may not literally even have the physical water. There's just cup, and yeah, it's just to show. The truth is, this exam is to assess your ability, is to assess what you will do when you start to practice on the ward. How do you give them their medication? What do you do? That's what it is, basically. Okay. So there may not be physical water, but your best bet in implementation, make sure after you've gotten all your medication, make sure here is your tablet, this is the medication. Now you've said all your indications and side effects. Okay, say all your indications, side effect. Here is the medication and here is the water. Okay, can you confirm for me that you swallowed the medication? All right, so I'll be going to do my chatting now. Okay, now, some assessors, when they see your time, what they do is some will say, oh, you've got few minutes to go, swallow, swallow. I've taken them. Some, just by the time you're asking, do you want the medication together? By the time you hear them saying, yes, I've swallowed this, I've swallowed it, they've swallowed it. Go and document. Okay? Don't be slow and looking. That's why I say listen, listen, listen. Listen to the promptings of your assessor. Listen when they talk. So some will give you that, oh yeah, 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 done, done. I've taken, just go on. continue. So we have 15 people here. Please, please like the video. Please like the video. Okay. We'll be rounding up soon. We're giving up ourselves. We'll be rounding up at 12. Do we have any other question, or let me share with us what we've got? Okay. So I'll just I've shared that someone failed assessment. Senior, good. All right. Thanks for that. I've shared why someone failed NG. And then why people will fail implementation sometimes is if we don't do. Oh, well, okay. Adela, I see you. If we do, please, if you've not subscribed to my channel, please subscribe. Okay, thank you. Right. So if we don't do our 5 rights, if we don't do second ID check, if we don't say after reading our prescription, and if we don't say I confirm the prescription is valid, legible, contain the prescriber signature and blip number, all of these things are in the marking criteria. If you don't say the right indication and side effect of the medication, those are the things that can fail us. Thanks, Nikita. Thank you. Those are the things that can fail us. So we want to make sure all of these are intact. We don't want to make these mistakes, please. Okay? For planning, you need to make sure your aim of care is realistic. You need to make sure your reevaluation date is realistic, is achievable. Those are the things they are looking at. In planning, you want to check, have they given you a time frame to plan for? If they have not given you a time frame to plan for, no point. Just do accordingly. Now, for planning, if you have communication scenario, if you have, sorry, community scenario, and they didn't give you a time to plan for, you can write on the at the next visit. Okay? Because if they have not given you a time to plan for, and you then go and put for you just go and put a particular time, you need to be careful. So for like pain, and it's a community scenario, you could write today, you put the date, after 30 minutes, on the next visit, and as clinical condition changes. Now we've covered all our ends. We've covered everything. So that's what we're doing. We're trying to we're building a safety net. Building the safety net is just to safeguard us, to make sure we are on point. Okay? So please look at the scenario. Did it say plan within 24 hours, or did it say plan for 7 days? If it gives you time to plan for, use that. If it just says plan for any two and it's community, try to put at the next visit. As clinical condition changes, those things you need to put them in. But if they give you a time frame, work with the time frame. I hope we understand this. I've just explained for the planning scenario. Okay, so someone has just asked, hi Bella, when we say my 2 minutes has started in BLS, we started giving 2:30 to 2 4 times. What will we verbalize in handover? Many cycles. Is this one? No, okay, good. So I'll explain to us what is one cycle, and then I'll explain to you when you start your 30 to 2 compressions. Please, oh, we are 15 here. We've not liked the videos, remaining 7 people. Okay, so let's go on. A cycle is 30 chest compressions, 2 ventilation. That's one cycle. 30 chest compressions, 2 ventilation. That's another cycle. So for every time you do 30 chest compression, 2 ventilation, 1 cycle, 30 chest compression, 2 ventilation, that's another cycle. So depending on when your assessor tells you there is now sign of life, that is when you stop. I want to beg you, please, please, don't do the compression and you get tired and you are looking at the assessor to say, is there sign of life? Please don't do that. You need to build momentum. You need to build energy Oh, thanks. The likes has increased. Thank you. We need to build momentum. We need to build energy to be able to continue until your assessor says there is now sign of life. Please and please. Someone actually did that in exam. The person said she did some cycles, and I think the person said, assessor, is that sign of life now? Or I think the person by herself said, there is now sign of life. Please, we can't do that. What will determine if your assessor will respond or not? Are you doing I'm happy we were able to see work with that app. The things that assessing us on in in-house resuscitation, the depth, the depth we're going at. Now there is when you get down, you will feel that obstruction when you're doing it. Make sure your hands are locked, properly locked, straight. Okay, and your elbows are directly over your hand when it is locked. Remember, we use our heel to perform this, to perform it. Okay? So please, that's what you need to do. Put all effort. Don't make it too fast. Don't make it too slow. When you count 30 chest compressions, 2 rescue breaths, go again. Okay? 2 rescue breaths. You know your cycles. So depending on when your assessor says there's now sign of life, if you have done 3 cycles, when you're handing over, you say you carried out 3 cycles. I want to answer the question of when we are going to say 2 minutes. Please let me know when it's 2 minutes. Now let's remember that when we call for help, when they bring in, when we say call double two, double two, please use the word double two, double two. If you say two, 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 remember at that time you're already. So some will say two, two, two. Some will say two, 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 two. Stick with double two, double two. Mirab, yeah, she says it's clear. Yeah, I just want to clear some other things. I'm happy it's clear. Good. So stick with double two, double two. When you stick with double two, double two, just say that, can you call double two and bring in the crash trolley? Some of you, your assessor may come, bring in the trolley. They don't wait for you. They connect it straight up. They've helped you. Don't get confused. Okay? If not, Cynthia is laughing. Yeah. Because some people will get confused. Why did she connect it? I want to give her the instruction. They've helped you. Just go on. So another thing is, once they've done that, if you get to the point, if they help you, fine. If they don't, give the instruction. Please connect the tube to the oxygen at 15 liters per minute. Allow the bag to refill. Then please, when you're ready, when you're ready, connect the mask to the patient's nose with the narrow end at the bridge of the nose and the wider end at the chin. When you're ready, let me know. Once you say that, when you're ready, let me know. She says, oh, I'm ready. You know, at that time, you're compressing. When you're compressing before help, before the connect oxygen, you are compressing, you are not counting, please. If you count, you would mix it up. Okay? The time you start to count is when you say, is when that mask has been placed on and she says she's ready. And then when you stop your compression, you give 2 rescue breaths. And then before you go back to start counting, you say, please let me know when it's 2 minutes. Then you start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9. Count to 30. Give your 2 ventilation. 1, 2, 3, 4, 5. Count to 30 to rescue ventilation. You may be very lucky if you do your depth and the rate, that's the speed, very well. The assessor may just tell you after a cycle or after 2 or thereabout, there's now sign of life. Then you stop. Once you hear there's now sign of life, you put the patient in recovery position, carry out your A to E assessment. And then after A to E assessment, what you do is do an handover using SBA, using your S bar. And that's where you now start to talk about all other things. Okay. So I just wanted to cover that. Then Umi says, please, if it's in the ward, do we say help, call 2222, get casually, or I press the buzzer, please? Okay, good. So let's look at ward scenario. If it's on the ward, what you need to do is hello. You need to, please don't just do hello, hello, hello. No, you need to tap hello, 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 and I pull the buzzer. So to help yourself, I'll call for help by pulling the buzzer, by pushing the buzzer. We've helped ourselves when you do that. Okay? So I call for help by pushing the buzzer. So you've covered your ends. And then I check, I put the patient, I check for any obstruction. There's no obstruction. Then I do the head tilt chin lift. When you do your head tilt chin lift, there's no obstruction. The hand is still placed in the head tilt chin lift. Then I look for the rise and fall of the chest. I listen for any respiratory noise. I feel for any respiratory breaths on my cheek. At that point, you are below, you are down like that. With your hand still in place, you are still there doing that. And I would look, listen, and feel for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There's still no sign of life, and I'll commence my chest compressions. And then you're just compressing. You are not counting. In between, before you finish or anything, your help would have come. So you start your compression. When you are giving instruction to your help, if they don't connect it for you, when you're giving the instruction, please don't stop your compression. You need to continue. If you are the lucky one that your assessor just comes and connects for you, once she's connected, once everything is there, you don't need to talk and compress, because some people struggle with talking and doing the compression. So if they help you, you don't need to talk and do the compression. Once it's done, let me know when you're ready. Compression, you're not counting. Once she says she's ready, give two rescue breaths, then you start counting. Wumi, Diola, did I answer your question about hospital setting, especially if they tell you you were on the wards? Please let me know. I want to know if I've answered your question. Okay. So before that, if there's no other question, let me just share with us some tips. Please and please eat before your exam. Anxiety will set in and all of that, but please, it takes like 3 hours. At least take some glucose. Some of you may want to fast, I understand, but you need some form of energy. Please fast the days before, fast this weekend for the day. You need energy. Remember, your brain needs to be working, and your brain needs glucose. So please give your brain glucose on the day, on the morning of your exam or before your exam. I don't think it's a time to fast for those who may want to fast. Remember to speak with your dummy or your patient and not the assessor. Talking to your assessor seems like you're looking for answer from the assessor. Okay? Always verbalize what you are performing. Okay? Don't try as much as possible not to have a long silence. Okay? You're talking your way through. You're talking your way. Remember, what they don't see, they would hear. So, no bedroom voice. Speak loud and clear. Be very audible. Go with an open mind to accommodate any changes. Don't panic. You may get there and they bring something slightly different. Don't be scared. In your head, tell yourself, I'm going to figure this out and I will do it. That's how it should be. Okay? Wumi said, just want to be sure there is no need to tell the helper and whoever to call double. Oh, please, you still need to call 2222 and bring the crash trolley for hospital setting. Oh, sorry. Okay, that was your question. Oh, I'm clear now. Hospital setting on the wards, they have a crash trolley, and we need to call the medical emergency team. That's what they're called. So you can use your 2222. So the fact that it's not on the road or anywhere, you would still need to bring crash trolley. You would still need to call 2222, which is the ACLS team. Okay, because it's not just all about doing the compressions. After doing the compressions, what happens? We still need the oxygen, and you get all your equipment from your crash trolley. You guys have been on the ward. I don't know if you've seen the crash trolley. There's a crash trolley. It contains a whole lot of resuscitation kit. So that is where you get the ambu bag that has the mask connected. So you must mention that. And you will still need to mention call 2222. Why? Because after your compression, even when the patient comes back to life, even when there is sign of life, they still need to take the patient for further care, appropriate care. Is it that the patient may need to go to the ICU or the HDU unit for appropriate care? So have I explained that, Diola? If it's clear, let me know. Just let me know. Just put a comment in the or a thumbs up in the chat box, okay? So again, the tips, good. I'm happy with that. Good. So forget about errors from previous station. Now, some people, your first station may be ANTT, it may be NG, and maybe you made a mistake or something, whatever, even if it's not your first station, any station that at the end you realize, oh, I didn't do this, oh, I didn't put the safety device, oh, any point in which you realize you've made a mistake, please, what you need to do is forget about it and move to the next station. Why? When you worry about that station, you are likely to bring it to your next station. And that's where you see people having one receipt, two receipts, three, four. So if you don't take anything from all I've said, take this. If you miss anything at any point and you begin to worry, once it's time for the next station, forget about the past, it's gone. Focus on where you are going. Put your mind there. Stay there, focus. This is what I need to do. So that if at all someone wants to fail, if at all, it can't be more than that. But let me tell you a secret. Sometimes people think that's what they will fail. They don't fail it. It then happens that it's that station where they are worrying, they miss key things, and that's where they begin to have issues with. So please, if there is anything that has happened, any error, forget about it, move on. Ahead we go, forward ever. You understand? You know how it works. Okay? Please rest and sleep well the night before your exam. Anxiety will come in, whatever. If you even feel I need to be reading, I need to be reading, put on some videos, put on some sounds, listen, try to sleep, have a good rest. You need to be in a good frame of mind for this exam. Pay attention to details and stay alert at all times. Always look around your surroundings. There are some traps in assessment. If you see a walking stick, if you see a pack of cigarettes, if you see a hearing aid, if you see glasses, anything you see, talk about it. Oh, sorry, is this yours? Would you need it? But if it's a walking stick, don't ask them if they need it because they need to sit down and listen to you. Do you get the drift? If it's a walking stick, you can pick it up. Is this yours? I'll just like to put it aside. If it's a cigarette, oh, sorry, is this yours? If you don't mind, can I put this in the locker? Because of the asset, we don't, especially if it's a hospital setting, because of the inflammables we have here, the oxygen and things, I'll be locking it away. Or if you want to give it to your relatives to take home, if it's a cup of water, check that this patient is not on nail by mouth. Check that this patient is not going for surgery. Hopefully your scenario is not that, because if not, you can say, oh, sorry, is this your cup of water? If you don't mind, I would like to take it off because you're supposed to be going for surgery and you're to be on nail by mouth. These are all the things they want to see and hear from you. They want to know what you will do if you were on the wards. Do you ignore the patient who is going for surgery and there's a glass of water or a glass of juice? Okay? So look out for the traps. But if these things are not there, don't assume there is glasses. You can't assume there's glasses. Oh, I said that there is glasses. I'll be taking. Please don't assume. Please, let's not assume what is not there, please. Okay? Another thing is instructions should be read and well understood at all times before proceeding with your station. I think last week, yeah, just some days back, some people, a mistake somebody made was she didn't read her scenario before she started. please, we need to read our scenario. Your scenario is your instruction. Read it, make sure you understand it. Sometimes it's your assessor who will read the scenario. So if they read it for you, good for you. Make sure you have a good understanding. If you have a question, ask before they start your time. Please and please always read your scenario properly. Pillow. Also, we have to take pillow away for the scene safety. Yeah, so depending on where the pillow is, please. Okay. And depending on your scenario, you need a pillow if it has to be like you want to check the blood pressure. So yeah, Cynthia, I think we just need to be clear. Depending on where the pillow is situated, if you have to take that out. The other tip I want to share is take time to check time, please. I think I've written that somewhere in the comment section. Take time to check time is important, please. As you are walking, eyes on the time. As you are walking, eyes on the time. And if you're almost finishing and it's a situation where you need to document, and I will document, say it with your mouth. Peradventure, they might take it into consideration. Okay. Now, most of the time, the fear we have is, oh, fear of failure, fear of receipts. Don't worry, you'll be fine. Please fight your anxieties, do deep breathing exercises, carry out positive affirmations. I will pass my exam. I understand. I understand this station. I'm not scared of this station. I would go and write my OSCEs. You need to do this for yourself. Learn to take in deep breaths. Practice mindfulness. If you know you're the type that your mind is drifting away, bring your mind back. Bring your mind back so you can be in the moment. You can practice in the moment, because sometimes we do something and we don't realize we've done something wrong, or we've said something wrong, and that's because of mindfulness. Okay. If you know how to meditate is thinking on certain things. So you can just sit down and think of the station, think of how it's going to be like, think of the good things, how you will finish, think of the nice things, how you will finish well, how you will write your planning station well, how you will document well. Please, all those, hey, I will fail this station, I will fail this station. Please don't dwell on that. Your mind and your body has a way of connecting, such that your body acts out what you have been meditating over time. So your body begins to work with your mind. Hey, I will fail this station, I will fail this station, I will fail this station. Your mind is working on it. So please, that should not be in your picture. Work with, I will get it right, I will get it right, I will not make this mistake, please. Okay. I hope those of us with sweaty palms will get now. Good. Thanks for saying that, Diola. Those of you with sweaty palms, spray deodorants. You know those deodorant, they're supposed to keep our armpits dry. Spray them on your hands. Put them on your hands. If it's powder, use a powder on your palms. They would help you for the day. They last very long. Good you asked that question. Okay. Then most likely, before you pick any gloves, look at it. If you're the type that naturally you should use a medium, go for a large. Okay, just go one step ahead of your normal size. Okay. So with this, I think I've said everything. Manage your nerves, create a professional rapport with your examiner. When you get there, if they smile, smile back. If they smile, oh, how are you doing today? Are you ready for the exam? Oh yeah, I'm ready. Just a bit nervous. Yeah, but yeah, I'm trying. Don't. Oh, how are you doing? Fine. Are you ready? Yes. No, relax. The assessors are there to help you calm. They will help you relax. So accept their offer of, how are you doing? They're trying to make you relax. So please do relax. Bring your shoulder down, relax. When you're tensed, your shoulder is up, but try to relax. Okay? Always try to take breaks in between your stations. It might be a toilet break, it might be a water break. Try to take a break. That will just give you a breathing session, just gives you a little gap. And if you have to do toilet breaks, yes, that's up to you. That's fine if you want to. Okay. I think I've said all the things, all the tips I want to share with us. If you don't have any question, is there any question? We are wrapping this now. Thank you so much, everyone that joined in. Thank you. I'm happy It was worth your time, and it's worth my time because people had some asked some questions that they still are not clear with. It's worth my time. I hope it was worth your time. Please subscribe. Please share my page with your friends. For those who are having their OSCE exam, let them subscribe to the channel. I'm going to be posting more, but on the channel at the moment, we just have assessment. I have other videos coming up. I've done planning videos. I've done some other videos, but I'll upload them soon as I'm done editing them. If we don't have any question again, I'll say thank you for joining in. And I'm wishing you all the very best. I wish you all the very best. Remember, you can do this. You have all in you. You can do it. Please go and succeed. Go and succeed. And whatever the case, you are still very good. You know what you're doing. All right. Okay. I'll say, oh, thank you. Everyone is saying thank you, thank you, thank you. I'm happy I'm able to answer you to the best of my ability. I'm very happy I can do that. Okay. When is the last live session? Is that Princella? I will do one before your exam. Yeah, I know you're cohort 7. I will do one before your exam. Oh, is that PQRST? What do you want to know about PQRST? Thank you for the session. Yeah. PQRST, what I wanted to mention was make sure you say the content of, P. Some people will just say P provokes. What provoked the pain? Start with where's the location of the pain? Then you say what provokes it, what makes it worse, what makes it better. Ask all those questions, all the content for P. Ask all the questions for R. Does it radiate? Does it move from this place to this place? I'm just trying to say, make sure we ask all the contents, please. Okay, don't leave those sessions out. Especially those verbalization sessions, you need to be very detailed. Okay. Oh, Nikita, thank you for your kind words. Thank you so much. All right. If we don't have any question, if we don't have anything, I'll leave you to enjoy your Saturday. And let me just write, wishing you all the very best. Okay. Okay. All right. Yes. Thank you. Thank you. Thank you so much. Thanks, everyone. See you. You can replay this video again if you want. You can watch it some other time. For those who have missed it, that came maybe later, and you can replay the video. You can fast forward it. That's the good thing. Fast forward it to the place where you want or where you missed certain things. Okay. All right. Bye. Take care. Bye. All right.